Thank you, Mr. Speaker. As I face the last 50 weeks, I'm a member of this Congress, I'm appalled at the amount of time we waste performances on things that will never become law, that shouldn't become law, and in fact, the American public doesn't care that much about. But yesterday, in the front page of the New York Times was something that people should care about, talking about the problem of diabetes and the complications that can lead to amputations, especially among men. It's no secret we are facing an epidemic of diabetes. Nearly 15% of American adults, more than 38 million people, have diabetes. And it's even worse among Americans 65 years or older, with a rate of nearly 30%. It's the 8th leading cause of death in the United States. Right now, we're marking up a commission to deal with budget deficit in our budget committee. The direct and indirect costs of diabetes alone in 2022 was $413 billion. And the extra cost for a diabetes patient was more than $12,000 per patient. We should make improvements in delivery that prevents the disease and the progression, not only for the health of the patient, but also for our healthcare system. Type 2 diabetes is a huge factor dealing with modern diet and our health habits. These factors, combined with genetics and limited access to healthcare, can make it a challenge to control blood sugar levels and contribute to the progression of the disease. It can result in serious life-threatening consequences on relatively minor events. People can have a problem with their foot. Start small with some nerve damage and maybe a foot ulcer, but it explodes, if not untreated, to more intense conditions like gangrene, require the amputation to save the life of the patient. Nearly half of diabetes patients develop this nerve damage, and many go on to develop the foot ulcers I referenced. And it's worse for people of color. African Americans are 2 to 3 times more likely to need an amputation. When we know that millions of Americans suffer from diabetes and face dire complications, why wouldn't we take the opportunity to do everything in our power to limit the progression of the disease? And there are, in fact, low-cost solutions that can remedy the situation. One that I've been working on for several years is the simple expedient of diabetic shoes, which deal with the foot conditions that is such a problem for people with diabetes, that can help prevent the problems that lead to those amputations. Unfortunately, diabetic shoes require a prescription from a doctor. I mean, it's not rocket science. It can be done by a nurse practitioner, by a physician's assistant, but we don't allow that. And it's an extra barrier for people who have problems navigating the healthcare system. They might give up or ignore it. It relays an extra cost, an extra time. If these delays can have profound consequences, if I mentioned. It's not a barrier for people with private insurance. They needed these shoes when they were 64. It wouldn't be a problem. Congressman LaHood and I have a simple legislative fix to address this unnecessary quirk in our healthcare system. It would allow nurse practitioners and physician's assistants to satisfy the documentation requirements at no extra cost to the patient, no extra delays, and do it directly. You shouldn't need a doctor to prescribe these shoes. This is just one of dozens of examples of common sense, bipartisan reforms that will reduce spending, improve outcome, and in fact, save lives and limbs. I hope we can focus on simple, common sense things like this that are bipartisan nature, that aren't expensive, and that make sense. I urge my colleagues to support this legislation.
The gentleman's time has expired. The chair recognizes the gentleman from Arkansas, Mr. Womack, for 5 minutes.